I mean, I'm blown away that, I did physio for 4 months at that other clinic, and, I got like little teeny tiny results sometimes, and then, it would just come back full force. And this is amazing. And this is a tool now that, I keep in my pocket. So,
right, yeah.
Yeah,
like you've learned exactly, like that's the thing, right? We did the diagnostic process. We learned like what was the underlying problem. It became pretty obvious fairly quickly that you're following the pattern, which the pattern is pretty clear, is like 30% improvement within days, and then it lasts. That's the criteria. And then we got that, like we hit that criteria pretty quickly. I mean, it only took a couple days to get to that point where it became clear that that's what we were dealing with.
Oh, right. Yeah.
And then it took, what total, how many days was it? How many times did I see it? 5 visits? 6?
Yeah, we were like a week and a half, maybe, I think, that I worked with you on it. Maybe 2, I'm not sure.
Yeah, a week and a half. Yeah, I mean, that's pretty rapid compared to how long you were having the pain. How long was the pain there for?
Well, when did I hurt myself? February.
Yeah, February. Now it's November.
So it's like 8 months.
8 months of pain.
Yeah.
And then you did all this physio and stuff beforehand. And that was, how long were you at the physio place?
4 months.
How frequently did you go?
How
many visits?
I was going, like initially I went twice a week, and then he would send me home with things to do at home. And then once my benefits ran out, I couldn't go as frequently because just couldn't afford it. So, down to once a week, then once a month, and the last appointment was actually supposed to be right when I was starting with you. So I went on and canceled it.
Oh, really? Okay.
Didn't give them any, just cancel. And they actually called me yesterday, I think, or the day before. And they're like, yeah, how are things going? So I did.
You should just tell them, hey, I'm all good. I'm better now. You guys helped me out. And
I should have actually but they caught me off guard. It was an unknown name on the phone. So I picked it up, and, she's like, yeah, this is a physio clinic, blah, 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 and I was like, blah, blah. So I told them, I said, I got a referral to the MSK clinic at the hospital, and I kind of fudged a little bit. I said, it's covered under OHIP. I don't make a lot of money.
Yeah. Just trying to let them down easy.
Yeah, and I said I'm doing well, so. Yeah.
Well, I mean, like there's a lot of. I think it's just it's a relatively new system. This whole approach is based on a medical discovery that was 50 years ago was made, and just the science we needed a lot of science to come in behind it and demonstrate that this does exist. These rapidly reversible problems where it's simply just a joint pressure distribution problem, and you can reverse them very, very quickly with just one exercise. We had to prove that actually is true. And so, it took a lot of validation studies. It took a lot of like reliability studies to then get a system in place where we could actually diagnose these problems across professionals, like reliably, listen.
I've done a lot of reading online about it.
Yeah, right. And even the information online is limited. Like it's hard for people to access this information.
Right.
I had to tell you about it because you had to just randomly, our paths had to cross in order.
Right. Yeah. If you hadn't told me, like if I've never heard of this McKenzie method, right? I'd never heard of it. And then, once you talked to me about it and we started working, I kept reading a little bit more. And it was funny because I was reading one case study and like, it sounded like me. He was describing me of the case study. And at the bottom it said, they were skeptical about this guy because he was skeptical. He didn't believe in the process and they didn't think he was going to do the exercises. It's probably not going to work for him.
Yeah. Well,
that's pretty
exercises. That pretty much describes every person that I see with back pain, to be honest, and not just back pain, but pain anywhere. A lot of people are like, I've gone through the same thing that you went through, which is they tried a whole bunch of stuff. They drained their benefits. They took them a long time. They got a laundry list of exercises to do at home. It just didn't work, or they worked a tiny bit, but they had to keep on doing them over and over and over again. Yeah. And they just, no one has time to do all like the lists of exercises that people often get prescribed.
This is so quick and so easy.
Yeah. Yeah, I mean, it was just for anybody watching this video, like you can confirm it was literally one exercise. I mean, that's all, right?
Yeah.
One.
I mean, I could just, like I said, I did it standing up when I was leaving the hospital. I just, did the back bends a few times just to be proactive, because I was sore, and then came home. I just ran downstairs, boom, 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 2 minutes, 10 reps. I come back upstairs, carry on, half an hour later, go back down, boom, boom, boom. It's so simple to do. Such a, it doesn't want to do it as crazy because.
Well, there's just this natural skepticism because, like we're saying literally, I mean, it almost sounds too good to be true. This is what I thought when I was first got into, I'm actually just writing out my story, which was when I first got into physical therapy. I was pretty dismayed by the whole thing. I couldn't get consistent results with people. I thought like, oh man, if I was in pain, I wouldn't want to do all this. Like look at all these exercises. I don't have time to do all these exercises, and it's not working the majority of the time. And so I was gonna actually just leave the profession and go to medical school. And then luckily I found the mechanical diagnosis therapy, got certified in that, which is the McKenzie method. Right. And then got down the rabbit hole, realized that there's this whole worldwide movement of clinicians like myself who have made the same realization. Yeah. We're going to leave the profession because they, couldn't get good, consistent results. And then they went, what? And they said the same thing. This is too good to be true. But then they took the training, went into it, started using it the way it's supposed to be used. And then we're seeing stories like your story, like thousands of people, hundreds of thousands of people. And, we're now we're in a really cool time because we have the opportunity to do this with people completely virtually, which for anybody watching this, I only saw you in person the first time, which was at the separate separate clinic, separate program than this. But basically all the work we did was online. I just had to coach you and your boyfriend. He was the hands-on part when
he was the hands,
just taught him.
He was like, I broke you.
No, he fixed you.
Yeah, that was the turning point right there.
Yeah, that was cool. That was like visit number 4, I think, or 5. We had we were getting pretty good results there, and the pain was decreasing, but we just needed that little extra. And
I didn't think I was going to get beyond that. I thought, this is me, my back's old, I'm stiff, I'm just not going to make it back there. And when we did that and I could push up all the way up with no pain, I was
I know, I got your reaction on video, and I think I'm gonna put that in like a little montage. And then
sure.
Just to show people that it literally took a week and a half. I mean,
and now I can do it without him. I can actually do it without the belt.
Oh yeah, that's amazing. Right.
I can get all the way up without the belt. I still use it because I feel it like when I've got the time, because it puts a little more pressure on my back. So I do still do it. It feels a little bit more comfortable, but I can do it without. If I'm in a hurry, I'm not going to say, well, I don't have time to go down there and lie on that board and strap the belt on. I'll just drop down up here on my yoga mat and just do them without it.
Yeah.
I can get up like where I couldn't. I mean, I couldn't get up,
Yeah, no, I know. I saw you.
Yeah, and now I, you know, without him with his hands on my back and without the belt, I can push all the way up.
Yeah. Yeah. Well, yeah. So, I mean, I don't want to go too in detail. This is just a kind of informative video for anybody watching.
Right.
I'm going to have a lot of educational videos and stuff to explain exactly what we walk through. The same phases, right? The reduction phase, which is when the pain starts to dissolve and decrease. And then there's the stabilization phase, which you're sort of in now, but you're kind of on the tail end of that, which is, making sure that you're keeping your back in a position where the pressure is not going to build back up and pain comes back. And now we're also blending that into the recovery of function phase, which now means like, let's get you back to your normal life and, functioning properly and bending in all different directions, moving in all different directions, and enjoying your retirement.
Yeah.
So I'm going to keep on monitoring you because the way I'm structuring this program is to keep up with you. I want to keep following up with you up to a year. So I want to make sure that a year later, you're still in the same position now, and you are able to use the exercise to then prevent recurrence, because that's the name of the game.
Yeah.
And
Yeah, sounds good.
keep you out of my clinic and out of my practice and on your own, empowering you to do all this stuff yourself. So I hope
that's the best part about it. Yeah, that I can do it myself. I'm in control of it. So I wanted to say something too that really helped me, that nobody has told me before. When you were, when I was doing them and I said, they hurt, and you're like, okay, does it hurt past 30 minutes? That was a huge help.
Yeah.
When I was doing physio before, and I would say to him, you gave me this exercise to do, but it hurt. He was just like, okay, well, don't do it.
Yeah, that's the worst. That is the worst advice that we have ever been, as a collection of health practitioners. The worst advice we can give to patients is, if it hurts, don't do it, because that's not true. That's the difference between hurt versus harm. And that is a very empowering concept. Once you learn that, yeah, that is. But I appreciate the feedback on that. I've had people say the exact same thing, where they were like, that was a really light bulb, eye-opening.
Yeah, and it took me a few times of you saying that to me for it to actually sink into my head. I was just like, oh God, this hurts, and after a few days I was like, oh yeah, half an hour. And it just made the world of difference. And then, I'm like, I can feel it starting to decrease. And then half an hour later, I'm like, yeah, it's gone. So that was a big help.
Pretty cool. Amazing. Yeah. Well, do you have anything else that, I think we pretty much covered the whole story there.
Yeah, just tell people, don't be skeptical.
Well, after this, I think their skepticism will drop significantly.
Yeah.
Hopefully people watch this long. I don't know, we've been rambling for, 15, 20 minutes now. So.
Well, you can edit it, right?
Oh yeah, I'll probably just do the whole thing, to be honest. I'll edit it here and there, and then I'll put up your video of us. So I think you've got a very cool story, but you've got a surprisingly common story. So this will really help a lot of other people. So I'm really appreciative that you did this.
Hey, no worries. You can thank Maria too.
Yeah, thanks a lot. Maybe we'll do a video too. We'll do some like check-ins, maybe 3 months, 6 months, 12 months. Okay. So we'll have the full story.
Perfect. Sounds good. Thank you so much.
Thanks, Sarah.
Okay.